This is Chuck Mancino, Director of PR for Pulsed Energy Technologies. I'm on with Josh Silver, President and CEO. Josh has been involved with the development application of PEMF technology for over 13 years. He has consulted with, lectured to multiple professional sports teams, thoroughbred horse trainers, doctors, scientists, chiropractors, and other practitioners on the clinical implementation of the technology. He is considered one of the world's foremost authorities on PEMF therapy. Also on the line is Dr. Doug Miller, chiropractor and owner-operator of the Aligning Wellness Center out of Baltimore, Maryland. Been in practice 28 years, 20-plus years working with collegiate and pro athletes, 19 years working with the Baltimore Ravens. The history of working with prestigious organizations like the University of Maryland Athletics, as well as the NFL Baltimore Ravens, places them as one of the most sought-after clinics in their region. Josh, take it away.
Thanks, guys. Thanks for being on here this morning. I just want to take a minute to talk to all the people that are first tuning in and don't know what PEMF therapy is. PEMF therapy, high-powered PEMF therapy, stands for Pulsed Electromagnetic Field Therapy. And it's an old technology that I like to say has been around so long that it's new. The sort of simple science behind it and how it works is that every cell is like a little battery, and when we run into injury or illness or disease inside that cell, we're able to take a little applicator from our unit and pass a strong magnetic field through the cell, and the cell retains the charge just like recharging the batteries inside of you. I mean, the concept is almost the same as those rechargeable batteries that we get from Energizer or Duracell, and we plug into the wall and we use over and over again. It's the same concept. This machine sort of accelerates or facilitates the healing process at the cellular level. I am both honored and blessed to be able to have Dr. Miller on with us today. Thanks so much for joining us.
Hey, Josh, thanks for having me here.
Thanks so much for taking your time to be here with us.
I think it's been over, 10 years since we met at the Professional Football Chiropractic Society event. And I'm sure glad we met, because that's when you first introduced me to this amazing therapy.
And the cool part is that people feel it. And that's one thing we won't be able to convey to you guys on the video here today is every person gets a sensation from using the product, from using the technology, and that's unique in its own right. There's 6 topics that we're going to talk to Dr. Miller about. I'm just going to briefly touch on them before we sort of kick it over to him and hear his clinical experience. You get a lot of athletes that use the machine, and we want to hear a couple stories maybe about athletes or cases where the high-end athlete has used the technology, whether it's collegiate, high school, pro. We know that standard chiropractic care can resolve 80% of the issues right off the bat, and for 20% of the people who still have issues, we sort of feel that 80% of those 20 can have their issues resolved with the PER 2000. We just want to hear on some of those issues. Third thing we want to talk about is what has this machine resolved for your patients that you didn't realize it could resolve? You know, a tough case, things that have come in there that you never thought the technology would do. And then I want to sort of bleed into the top 3 or 2 toughest cases that stick out that PEMF helped with. I want to know if there's anything that it doesn't help with. A lot of people have told me they do Google searches and it seems like it's the panacea, and we know it's not the panacea. So there has to be 1 or 2 things. Maybe it didn't really resolve. That'll help some people out there. And then the last one is for the practitioners out there that are going to be listening and watching. How do you sort of uniquely market or advertise the technology in your area to let people know, hey, not only are we cutting edge and we're top of the line here, but we've got something unique that might help you. So just for everybody out there, that's sort of what we're going to cover. And if you want to sort of start, Dr. Miller, on some of the results that you see versus the athletes with the machine, I think that would be a good sort of starting point for all of us.
Yeah, absolutely. Well, your question was, what does it help with? And in my line of work, working with a lot of athletes who have acute injuries, but also the general public who has a lot of chronic issues as well, the key, in my opinion, is it helps to decrease and down-regulate the inflammatory process. So when there's an acute injury, there's inflammation. When an injury becomes chronic, there is residual inflammation, which produces the pain. So obviously, the sooner you get the PEMF therapy on the injured site, the quicker you reduce the inflammation. I'll be also the first to say, I've never used PEMF therapy simply as a standalone. I don't think it's meant to be a standalone therapy. It's meant to be a protocol to treat injured people, people that have acute injuries, patients who have chronic injuries. So it's something that's part of the protocol to get people back in their lifestyle or athletes back in their game. And you said it right there. Looking at a grade 1 ankle injury where just by without having this therapy, you're looking at about maybe 2 to 4 weeks of that player or that person being out of work or off the field. Having a tool or technology that's used to accelerate injury, and I do mean accelerate injury probably by about 1/3, getting that athlete back on the field 33% quicker is a big deal for athletes. It's a big deal for coaches. And that also parlays over into how do you market the injury? How do you market the therapy? You market the therapy by getting it on an athlete or a player. They market the therapy for you. Athletes are your own best friends. The quicker they recover, the more they tell their colleagues about that. I don't really have to market the therapy. Our patients market the therapy for us.
I mean, that's pretty amazing right then and there. It's the old concept of it selling itself, and it has always been a results-based therapy. And I think one thing that you touched on that's really important for people to understand, I've heard this a lot over the years, it is not a standalone therapy. It is best as the adjunct therapy, is being used in combination with chiropractic, with the adjustments, with some of the other things that you are going to be doing as sort of the catch-all, as the practitioner. I think that's important for everybody to know out there. It's
one of the things that really sparked my interest. I think when we first met, you never stood at the podium and said it's a standalone therapy. It can be used to actually facilitate healing of other treatment protocols that are offered in a chiropractic office. It's, having someone stand on the stage and tell you this is the end-all therapy for all conditions really doesn't go over too well. So in my application, it really has made a difference because I've got 28 years experience. I've got 10 years of experience with this tool, 18 years not having it, and just seeing the additional results that we see in terms of accelerating healing is truly amazing.
Do you have, it sort of prompts a question. In your experience, do you feel that the higher end athlete, high school, collegiate, pro, the let's say the human being that is in a much better or healthier state, do you find that they'll respond to treatment faster or more efficiently than, let's say, somebody that has had a chronic injury, somebody that maybe is not like myself at the level of a pro athlete? Do you think they respond faster? Do you think everybody responds the same?
I think they respond faster, and I talked about that a minute ago. I think it's based upon the factors that influence the inflammatory process or load. So athletes are more active, they have healthier diets, they have cleaner diets, the general population's more sedentary, they have unhealthier habits that promote inflammation, they take longer. Athletes respond faster.
And I think that lends to the thing is you only have so much control over your patient while they're in the office. And if they leave your office and don't do what's recommended, you can not be a salmon swimming upstream, but you can't control once they leave the office. And that's always the hard part, right?
Absolutely. That's true. That's true.
Are there any go-to issues that when somebody walks in the door, hey, doc, I have this going on or that going on, like right in your head, PEMF, I got to get them on the machine. Is there anything that immediately jumps out?
An osteoarthritic knee, hands down. Osteoarthritis of the knee. The longer you're in practice, you can almost spot that knee out. You can almost see that arthritic knee. Obviously the examination, certainly confirms that. But the sooner you get this therapy on the osteoarthritis knee, the less pain they have, the increased range of motion they have. You got a lot of people who are trying to put off time before they have to get a new knee. So this is certainly a therapy that can help provide them more time, a higher quality of life, reducing the needs for medication. God knows the needs for opioids. So certainly managing the osteoarthritic knee. And just like the athletes, everyone who has an arthritic knee knows someone else who does. So that population of patients starts to fill the office as well.
So, I mean, I don't mean to jump around, but you've hit on a really, really good point here a couple times. It sounds like versus, let's say, other technologies, other therapies, other things that you've got there, there's not a major need to promote, hey, look what we're offering, and do television commercials or radio ads like you see with other therapies. It's more like, let's get the patient on the machine and get the result, because then the word is going to spread that Mary's knee or Joe's back has really responded. Is that fair to say?
That's fair to say, but let's not go back. Let's say in my particular case, I'm a well-established office, so I have lots of patients in my office. If you're a new office, there's always a need to market. You're always marketing your office.
Sure.
Your office is either growing or it's not. But my marketing strategies are to market it within the office, which also markets outside the office.
What have you found is the best strategy marketing to the office? Just communicating to patients, hey, we've got this technology to try. Giving them a little quickie demo. What have you found to be the most effective?
We simply include it as part of our protocol. We don't really offer it as a demo. Awesome. We simply provide that as a service. Our patients understand why they're receiving, or what the care is that they're receiving, and what the benefit of the care is. And everything that we do in our office is designed to reduce the inflammation. If it's the chiropractic adjustment, if it's the nutritional side, if it's the exercise side, if it's the therapy side. So when they're performing their actual care plan, they understand why they're going through that. So it's simply part of our care plan.
And I mean, again, it's patient education. That's exactly what it sounds like. They know what they're coming in for to receive with you, and clearly they're getting the clinical outcomes, and that's the name of the game. So like you said, you've had the machine for a long time, and you have lots and lots of cases. This probably goes back a little bit further when you first had the machine. Was there ever a case that sticks out that maybe you didn't think the machine was going to be able to help, or never thought about, and all of a sudden you got a result?
It was actually in terms of diagnosing. I think you and I have talked about this in the past before, and I don't train other chiropractors, but the more you have this in your hand, and you're really unsure what the true etiology or the source of the problem is it a bursitis behind the hip, or is it a hot disc in the back? They can look a lot alike. You may not know that. If you use the therapy diagnostically, and the patient tells you where they perceive more of the pain, that's typically the source of the inflammation. So it's really helped me key in my care and my treatment. If I'm uncertain if it's a hip injury or a back injury, the PEMF can help guide me in as to what the primary source of that patient's problem is.
I mean, that's awesome, because essentially what you're saying is it's able to tell you the best place and to do what you do best.
To apply therapy, correct. And we're not using it to diagnosing the problem. We're using it to aid in what our differential diagnosis is.
Sure. I mean, what you're getting at is it may be somebody's back, maybe somebody's hip. We're not 100% sure. The machine sort of guides you, and then you can do your work and get the adjustment or get the result. And that's, I mean, I get that. That's how do you tell people that except you do it and you show them? That's pretty awesome. Are there any
just like you said
cases?
Just like you said at the beginning, patients feel this therapy, and it can be noxious or uncomfortable at times as well, based upon how inflamed they are. So there's ways to certainly deal with that, but having a patient perceive that level or that intensity of therapy really does, they expect to see the results, and they'll come off the table, and within 12 or 24 hours, the next time you see them, they're experiencing the results of all the things that you did, but they really experience the results of the PEMF therapy because they perceive the results during the therapy as well.
And so that was part of the next question, is typically you see the results immediate and the next day. It's sort of a combination of the two. Yeah.
Absolutely. Did I lose you?
One other question that has come up. No, I'm still here. One other question that I still had was related to anything that you haven't seen it work on. Is there any results or any clinical outcomes that you were expecting? Hey, the PEMF was going to knock this out along with our chiropractic care, along with our program, and it really didn't touch it. It really didn't make a difference on?
I think if you go back to looking at how we operate in our office, if it's a deconditioned athlete or if it's a deconditioned patient and they don't have the muscle strength or muscle balance to support the work that we're trying to do, they're going to re-inflame as soon as they walk off the table. So it really comes down to how you evaluate and how you work up the patient. So I think the more comprehensive approach you take in managing the case, the better the therapy is. Go back to what I said at the beginning. If you simply use it as a standalone, it may help, it may not. But if you really have a comprehensive strategy for assessing the patient, diagnosing the patient, treating the patient comprehensively, I think it's a great therapy for all patients.
You're sort of touching on a concept I've heard a lot over the last couple of years that really sort of hammers home is lifestyle change. Is you can lead the horse to water, you can teach them to drink, but if they don't do the process in which you've told them to resolve the issues are going to come back. So it's just like with anything, you really have to work at it as a patient. It's not just the practitioner's job;
Absolutely.
It's the patient's job as well, and they have a role in it as well.
Absolutely.
Anything about PEMF that you didn't expect going in that has happened? Is there anything that you sort of want to share about your experience now? I think it's been, we've known each other over 10 years. I think you've had the machine over 8 years. Is there anything that you didn't expect to happen that has happened, or is there anything you want to share?
I probably did not expect as many patients to return to the office asking for PEMF therapy as a way to manage their chronic injury. Chiropractic is amazing. We have a lot of patients that return and use chiropractic care as a lifestyle. And when chiropractic care alone is not enough to manage their aches and pains, the PEMF therapy as an addition certainly is. So seeing that population return and refer others has certainly been rewarding as well.
I mean, that's and really goes to my last question, which was related to other, we every day we still meet doctors, chiropractors, physical therapists that don't know what PEMF therapy is, has never heard of it. Is there anything that you can say to a first-time doc that is just discovering this for the first time to maybe shorten their education or information? Say, hey, take a look at this or take a look at that, or here's sort of why you went with it.
Well, I mean, I think it goes back to what I said a minute ago. If you understand the aspects of chiropractic care, and if these conditions are left uncorrected, how that promotes inflammation in and around the injured site, and eventually systemically, now you have a tool that helps you diagnose that problem and helps you treat that problem along with other lifestyle changes as well. So it's kind of an easy fit for me, but for me, it's based upon my training and my background. For young practitioner, I'm not sure. My first time with this was after 18 years in practice. So, for young practitioners, simply to get your hands on it and to use this in the office, you're going to have a lot of successes, but the more comprehensive you are with your care plan, you're going to have even more successes with your patient outcomes as well.
It all makes sense. And, it's hard not to make it sound like it's the greatest thing since sliced bread, because we've both seen some pretty amazing clinical stuff, but it really, as an adjunct therapy, it seems to be just so successful in a lot of areas. And it starts with what you said about the inflammation and breaking that cycle. Chuck, I just wanted to ask you, are there any questions left that people had sent in before our meeting to cover? Is there anything left that we'd like to ask?
We've semi-covered some of it. One of them is, what percentage of patients, whether it be athletes and what have you, that walk in the door and have heard of PEMF, I'm going to guess the answer to that. Is that a fairly low number? I
would say it's probably less than 1% that have heard of that therapy.
Wow.
Yeah. And
then how do you, I know patient education has been brought up a lot on this call. Is there anything in particular, or I don't want to say trick, but what's the best way to get them to understand what PEMF is and what to expect and why they should be excited about it? Do you have any certain way that you express it?
Yeah, absolutely. The problem you're having is inflammatory based. We have therapies in the office that address inflammation. We're going to begin that care today. It's quite simple.
Excellent.
Yeah, it's quite simple.
Is there anything in closing or in summary you'd like to say, Doc?
I think it's a tool that there are obviously chiropractic. There are chiropractors that simply adjust, and that's certainly fine. There are chiropractors that have other therapies and modalities in their office. So for that population, especially for those who want to treat athletes, I think it's a necessity that you look at incorporating PEMF therapy into your office.
Very good. Josh, summary from you?
Just to say that I'm so thankful and blessed that we got a chance to do this. And for anybody that's watching, you can sort of gather the theme here is that Dr. Miller has been using this for quite some time in his practice. He's used it on the high-end athletes and the low-end athletes, like people like myself. And the theme here is that he's really able to get involved with the inflammation cycle, which is a main factor in all sorts of pain, all sorts of injury, and utilize that to sort of facilitate the other treatments and really the adjustments and the work that they're able to do. That it's not a standalone, it's a hand-in-hand type of technology that, at least by our conversation here, seems to work on most of the things that he would see in his office.
And Josh, I think we're going to have a contact link to me. So if any of your clients want to ask me any direct questions on how I use this, they will certainly have access to that.
That's fantastic. Thanks for doing that. As we end here, it's going to go to another screen, and we're going to have exactly that. So they'll be able to contact you directly and ask sort of practitioner your experiences.
All right. Hey, thanks for having me here. I appreciate it.
Doctor, thank you so much for your time. Same with you, Josh.